What is hematochezia, and what are its rectal bleeding symptoms? Imagine seeing bright red blood in your stool or on the toilet paper after a bowel movement. That's often what we call hematochezia, a medical term for fresh, vivid blood passing through the anus. It usually indicates bleeding from the lower part of the gastrointestinal tract, like the colon, rectum, or anus. Sometimes, in rare cases, heavy bleeding from higher up in the digestive system can also show up as hematochezia if the blood moves quickly through the intestines without being digested. When someone experiences hematochezia, they might notice blood on their stool, which can appear as streaks or spots, or it might be mixed in with the stool itself. The amount of blood can vary from just a few drops to a significant amount that causes concern. Often, people also see blood during or after a bowel movement, and it might be accompanied by other symptoms like pain, especially if there are anal tears or fissures, changes in bowel habits, or abdominal discomfort. From a colon health perspective, hematochezia is an important sign that should never be ignored. It can be caused by benign issues like hemorrhoids, which are swollen blood vessels in the anal canal that often cause painless bleeding. Small tears called anal fissures can also lead to bleeding and pain during bowel movements. However, hematochezia can also be a sign of more serious conditions such as colorectal cancer, especially in older adults or those with risk factors. Tumors in the colon or rectum can bleed, sometimes resulting in noticeable bright red blood. Other causes include inflammatory bowel diseases like ulcerative colitis or Crohn's disease, which cause inflammation and bleeding in the colon. Diverticulosis, which involves small pouches forming in the colon wall, can sometimes bleed heavily. Infections or vascular abnormalities may also lead to rectal bleeding. Because the range of causes varies from harmless to potentially life-threatening, medical evaluation is crucial. Doctors typically start with a physical exam, including a digital rectal exam, and may order blood tests to check for anemia. A colonoscopy is often performed to look inside the colon and identify the source of bleeding. If upper gastrointestinal bleeding is suspected, an upper endoscopy might be done. In summary, hematochezia is the passage of fresh blood through the anus, usually with stool, and it's a key symptom of rectal bleeding. While it often points to issues in the lower gastrointestinal tract, it can sometimes be caused by rapid bleeding from higher up in the digestive system. Recognizing this symptom and seeking prompt medical advice is essential for early diagnosis and treatment of underlying conditions, including colon cancer. Always consult a healthcare professional if you notice any unexplained rectal bleeding to ensure proper care and peace of mind.